How VenaBLOCK works. The science behind the treatment unveils the mechanistic and scientific underpinnings of VenaBLOCK, an innovative varicose vein treatment. VenaBLOCK employs a medical-grade cyanoacrylate adhesive to occlude varicose veins, a common condition where veins become enlarged and twisted due to valve failures that prevent blood from flowing efficiently back to the heart. This condition can cause discomfort, swelling, and serious complications like ulcers or thrombosis if left untreated. Mechanism of action. The core mechanism of VenaBLOCK revolves around the targeted application of cyanoacrylate adhesive within the affected vein. Cyanoacrylate is a fast-acting adhesive that polymerizes upon contact with blood, transitioning from a liquid to a solid state. This reaction seals the vein shut, preventing blood from entering and pooling within it. Over time, the occluded vein is absorbed by the body, and blood flow is naturally rerouted to healthier veins, thereby alleviating symptoms associated with venous insufficiency. Scientific basis. The scientific foundation of VenaBLOCK's effectiveness lies in the properties of the cyanoacrylate adhesive. Cyanoacrylate's rapid polymerization in the presence of moisture, a characteristic leveraged in medical glue applications for wound closure, provides an immediate and durable seal. This process is crucial for the permanent closure of varicose veins, ensuring the veins' walls adhere together quickly, effectively reducing the risk of recanalization and varicose vein recurrence. Procedural advantages. VenaBLOCK treatment is distinguished by its minimally invasive nature. Administered under ultrasound guidance, the procedure allows for precise delivery of the adhesive directly to the problematic vein without the need for extensive surgery or thermal ablation. This precision minimizes damage to surrounding tissues and reduces the procedure's overall risk profile. Efficacy and safety. Clinical studies and real-world applications of VenaBLOCK highlight its high efficacy in achieving vein closure and symptom relief, alongside a favorable safety profile. The immediate closure of the vein addresses venous insufficiency symptoms quickly, with most patients reporting significant improvement or complete resolution of symptoms such as leg heaviness, pain, and swelling. Recovery and quality of life. A significant advantage of VenaBLOCK is the minimal recovery time required post-treatment. Patients can usually resume their normal activities almost immediately, a stark contrast to the recovery periods associated with more invasive varicose vein treatments. This rapid return to daily life, combined with the procedure's minimal discomfort and excellent cosmetic outcomes, significantly enhances patient satisfaction and quality of life. Conclusion. VenaBLOCK represents a significant advancement in the treatment of varicose veins, offering a scientifically grounded, effective, and patient-friendly alternative to traditional treatments. Its use of cyanoacrylate adhesive to achieve immediate and durable vein closure aligns with the evolving healthcare landscape's emphasis on minimally invasive procedures that not only provide clinical efficacy but also prioritize patient comfort and rapid recovery. Through VenaBLOCK, patients gain access to a revolutionary treatment that promises to transform the management of varicose veins, encapsulating the intersection of innovation, science, and patient care in modern phlebology.